Okay, so we've produced one video showing the power hood as personal protective equipment for dealing with COVID-19 patients, and this is going to focus on the FFP3 mask for those that have been fit tested and passed that fit testing, and face and eye protection as well. So the first thing donning is we're going to put on our inner gloves, okay? And just like in other videos, the donning part is not as important as the doffing, because that's the point at where there's the greatest chance for self-contamination, okay? But you still need to make sure you're putting things on properly, okay? So first of all is the inner gloves, which are going to stay clean, okay? Relatively clean. Then I'm going to put on my gown. And again, it feels strange putting this on without worrying too much about sterility like we normally would be used to if we're doing essential eye. But at the minute, we're all clean and it's about protecting ourselves from the patient, not the other way around. So thank you, Joe. My buddy is just doing my Velcro up at the back, relatively light so the gown peels off okay, and also tie me up at the back. I'm then going to put on my outer gloves, which will be my dirty gloves, making sure that my sleeves are properly covered. Next is the FFP3 mask, FSM 18 standard. I'm going to pop this over my face, two straps. The lower one goes over my neck and the upper one goes over my head. Make sure it feels nice and even both sides, the straps are comfortable, and around the nose, pinch in at the same time with your left and right hand any gaps that you feel exist around your nose. Okay. Make sure you're clean shaven for this as well. So that mask feels good. Okay, so now I'm going to put on my eye protection. I'm going to use one of these over the face visors, but you can also use one of these masks with the incorporated visor attached to it. Okay. So this will just sit over my head. Make sure it's nice and comfortable. Okay. So it's a good idea at this point to get your buddy to just check you from behind, make sure there's no bits that you're missing, no rips in your gown or anything like that. Okay. When your ODP or your assistant is going to don in exactly the same way. Okay. And in this example, we're going into a room to perform intubation. So I'm going to take a couple of waste disposal bags to put in the stuff that isn't for cleaning or reuse. I'm going to take in my COVID intubation pack with everything that we can think of that we might need for a COVID intubation, so we're not going in and out. I'm going to take my tray full of drugs, including propofol infusion syringes, and then my ODP is coming with me, is going to bring the ventilator, and in this case a CMAC or a McGrath video laryngoscope. So now I'm going into the room. Okay, so now our patient is intubated, ventilated and stabilised. I'm going to show you through the doffing procedure for the FFP3 mask and face protection so that I can leave the room. First of all, these gloves are dirty, this gown is dirty, so I'm going to reach across my gown, pull the gown off with my arms crossed so that the gown folds in on itself. Think careful, step away from the gown and pull off the outer gloves with the gown. I'm going to put it in a bin as I do that. So outer dirty gloves and gown off in the same go. I'm then going to clean my inner gloved hands, which are already relatively clean, making sure that I give the alcohol time to dry, because that's what kills the bugs. So once that's done, I'm going to reach behind my head, hold the strap, and take the face visor off, lifting it carefully away from my face as I do it. And I'm going to drop it in the bin. Okay? At this point, I'm going to take my gloves off, the inner ones. I'm going to clean my hands again and leave the room. So I've just left the room with the respirator still in situ, the FFP3 mask, and now I'm going to show you how to take that off. Okay? So I'm just going to clean my hands again one more time. Anytime you do any stage, always clean your hands in between. If you're going to put your hands anywhere near your face, clean your hands and wrists. Let the alcohol dry again. So now I'm going to reach behind my head and grab both straps at the same time. Okay, the bottom one first, and then the top one. I'm going to carefully pull the straps off over my face, lifting the mask away from my face, disposing of it in the bin. At this point, I'll keep my hands again. And that is how you do donning and doffing for the FFP3 mask.